Welcome to Westchester County, our Facebook Live, and continuing dialogue and discussion as we continue to go through the coronavirus crisis and dealing with all of the issues that we have. Today with us, we're really privileged to have Chief Michael Volk. Mike Volk is the Director of Communications for the Emergency Management Services, EMS folks. The folks that are out there every day and taking care of things. Just for a little bit of background, people don't realize a lot of things that we do under emergency services that the county does for the people of Westchester and coordinating over the 45 different municipalities. We dispatch out of what we call 60 Control 31 out of the 50 emergency services agencies, the EMS ambulance service agencies in Westchester County, so 31 out of the 50 EMS agencies. In 2019, we had over 68,000 EMS dispatches that came out of 60 Control. That's when you call your 911 operator and need an ambulance service in the communities. The call volume was 172,000 phone calls that they had. And that means that the great staff and the great workers that are on the phone were able to deal with some of the issues before a dispatch needed to be done to be able to work through those particular things. And we have 26 emergency call center operators and additional support staff. So Chief Volk, thanks for being with us today on Facebook Live and being able to talk to the people of Westchester and let them know what things are happening and how things are working in this pandemic, in the scenario with our emergency, our EMS folks that are going out to those folks. You know, we know EMS is at the front line. When people have issues, they pick up the phone, they call 911. Those folks are the first ones through the door many, many times. So we are very appreciative of all the hard work and the first responders and the folks that are out there that are doing this particular work. And they do that work day in, day out. A lot of times there's volunteers that are involved, and I want to make sure that you talk about that. But certainly during the COVID-19 coronavirus outbreak and pandemic, there's been a tremendous increase in the EMS service calls that are happening. Chief Volk, can you give us some words around that?
Yes, good morning, Deputy County Executive Jenkins. Thank you for allowing me on your call. Good morning, everybody. EMS is on the front lines of this event. They are often get called out when you need an ambulance, if you have a healthcare issue at home. Specifically for this event, the call volume overall has been down for the general illness type calls, but definitely the COVID type events for respiratory distress, flu-like symptoms, excuse me, flu-like symptoms has increased. So I want to give my hats off to the EMS agencies. Many of my friends and colleagues through decades are out there on the streets putting themselves in harm's way to take care of these very sick people who are out at their homes looking for care.
Well, Chief, I think that one of the things that's really important to continue to let folks know, a lot of times, again, every community, I happen to live in a community in Yonkers that has a paid ambulance EMS service. There's many communities that have volunteers that are out there on those front lines. Can you talk a little bit about that? Because as you said, the call volume has been down from the COVID-19 scenarios where people are experiencing those flu-like symptoms and they can't breathe a lot of times, and they know to call 911 to call for their ambulance service. But the other folks that are out there that are still experiencing the other medical conditions, they may be reluctant right now. Can you remind them again that the EMS services, ambulance services are still available, and they should take advantage of those things, because we don't want people to lose valuable time, and every minute is valuable.
That's a very good point. I think the medical emergencies that occur every day prior to COVID and the pandemic, and before and after, is people still have the chest pains and heart attacks and strokes and other medical emergencies, such as a diabetic event. Is I would encourage all those people who have a true emergency to call 911 and actually request assistance. There are resources available. I would say make sure you have a true medical emergency when you do have that.
All right, awesome. So can you talk for a few seconds, because there's a lot of confusion out there about things that our first line and our first responders have to experience. You know, are the EMS personnel specifically trained on dealing with infectious disease?
Another good question. So yes, infectious diseases exist throughout our year. We do have our annual influenza. That's highly contagious. Our EMS providers are exposed to that. We do have cases of tuberculosis in the county and throughout our state. So providers are trained. This is a little bit of a different scenario. They do have to, based on OSHA, be fit tested with respirators. Agencies are responsible and required to protect their providers in doing that. So yes, they are familiar with. Again, it's a little bit different these times. I think providers are probably a little bit reluctant to catch COVID-19 themselves, and probably a little afraid to bring that illness back home to their families when they come home from work. So I think with good personal protective equipment and with good hygiene, meaning if you're washing your hands frequently and prior to going home, you're changing your clothing and showering when you get home, you can keep your family safe. But it's a little bit different environment this time.
So again, in this particular environment, are we, what's the guidance that's been given from our Emergency Operations Center to all of those first responders to deal in this particular environment where we are right now? And certainly things have changed from the very beginning to where we are now from a contagion perspective. So what things are being told to those first responders?
Initially starting out, we would ask lots of questions. We would do what we refer to as the doorway triage. So when a provider would come to a residence or dealing with a patient, they would ask specific questions early on about travel. Did you travel outside the country? Did you travel to Asia, specifically China? Do you have any flu-like symptoms? Those things still exist. I think at this point, with the large numbers we have, I think all the providers are taking all the PPE precautions they need to. So they're putting their respirator mask on. They have eye protection for splash on. They have gowns and gloves. And not that all those things are not common daily. We usually have gloves on all the time. And if we suspect something that's contagious, we will put a respirator mask on. Again, there's challenges with that when you listen to our news and in the county. I guess fortunate and unfortunate, in 2014 and 15, we had the Ebola crisis. We did a lot of training and we did provide equipment to agencies at that time. And many of them had equipment left over. Probably some of that equipment, if not all, was expired. But we received federal guidance that even expired equipment will be beneficial. So we did have some that kind of breached the gap early on. And with the help of our Office of Emergency Management, we've been providing additional PPE out to the agencies that need it. Again, we have to work with providing the hospitals or nursing homes and other providers with that equipment and kind of balance out a very limited amount of PPE.
Well, and that's an important critical point to mention as well. Our emergency services is the manager for the Emergency Operations Center and has the understanding and connection with all of those providers, but all of those requests get fed into there, and then they're balanced off based on priorities that the state dictates with hospitals and nursing homes, assisted living, et cetera, and our first responders. You said respirator mask, Chief Volk. I think that is kind of critical to explain to people, because everyone, we all get a chance to watch on the internet like folks are doing right now with Facebook or maybe YouTube later on and follow up. later on this particular conversation, and they hear N95. They watch a TV show and they got the N95 mask and the gown on, and etc. That means everyone needs an N95 respirator mask versus what we're being told now to use face cloth coverings and surgical masks and that kind of thing.
Correct. That's a much different product. So the simple face mask or the surgical mask, maybe an ear loop mask or something that's maybe made out of a bandana or a t-shirt, is much different than the N95. N95 is a very fine particulate mask that has to be fit tested to the provider. They need a pre-medical clearance to actually wear that mask.
Wow.
And it really filters a lot of the small particulate out, specifically to viruses. So that's really a direct medical provider piece of equipment. That's not something the lay public should be wearing. It's not always easy to breathe through that, like something that's cotton or cloth. So I would encourage agencies or individuals and citizens to go with the simple face mask. It won't provide you the same protection, but I think with the limited numbers we have for our emergency services and healthcare providers, along with the fact is you may be putting yourself in jeopardy by wearing that mask if you're not healthy and you don't have a good respiratory system.
That's again an important point, especially again for our EMS and ambulance folks when they go out. Now you may be asking them to go into an environment and they have to have that equipment, and you may be taking that away from them, especially in our critical path right now. Well, I know that there's been a lot of folks that have gone out there as the first responders. Clearly, as you said, that some of those EMS and ambulance frontline workers have been exposed to COVID-19, and that has caused some challenges in making sure that those folks have the staffing and the things that they need to get out and support individuals, as well as the other challenge that you could speak to, Chief, which is, usually when we have emergencies happen, whether it's a fire, whether it's a car crash or anything like that, it's a defined period of time. We've been doing this from the Emergency Operations Center from March 3rd. And basically you've had folks in ambulance corps and frontline workers, hospital workers, all those kind of things that have been working 12 and 14-hour days on weeks and weeks on end. Can you talk a little bit about that?
Sure. Let me start quickly by saying we have a very fragile EMS system in the county with the combination of career, combined departments of career and volunteers and full volunteer departments. It's very difficult to day-to-day get units out on the road. I think with this pandemic, there's a little bit of a benefit that we now have many residents who may volunteer at their fire department or on the ambulance for the volunteer ambulance corps, home and available to do that, along with some of the college kids. They provide great resources, especially during the summertime, to feed into these responses. So I think when you talk about the availability, adding that extra little, okay, I'm exposing myself to a pandemic, I'm doing this to help my community, I'm a volunteer, do I really want to do this anymore, number one. And number two is many providers, especially on the career side, they're working multiple jobs. Many providers probably work 80 hours a week to kind of make ends meet. Not being a required or a mandated service EMS it's not on par with fire and police services nationwide. So it's a little bit difficult. Now we're asking even more of our providers who may be short-staffed due to being home on restrictions or being home because they're actually sick with COVID. So it's a challenge. We do have a mutual aid plan in the county. It does work well day to day. At times, and especially during this event, is ambulance, the ambulance being out of service longer is due to a number of factors. When they're transporting somebody to the hospital, it takes longer because now you're waiting for a bed in a very busy, hectic environment. So the ambulance may be tied up at the hospital a little bit longer. Plus, after you're done with the call, you have to decontaminate. You have to decontaminate your staff. You have to decontaminate your ambulance. I know early on we were decontaminating ambulances, and the recommendation was to allow the ambulance to air out for 2 hours. So in doing that, you wouldn't have the unit available for multiple hours. That increased our mutual aid request times. So we kind of tried to cut that down. We provided some equipment to the agencies. Some other agencies in our community also shared their experience, expertise, and some of their equipment in decontamination, which actually expedited the units returning to service.
Well, you know something, and that Chief Volk, that's an excellent point to point out to people at this time, and to really think about what things that we could be doing all together, the county residents and the folks that are paying and watching us right now, and that are going to follow up again social media wise, to see what things they can do to assist. Talk two sides. What does the county provide as far as training is concerned? Because there's an excellent training facility that the county has, and I know you've been involved in that. But also what people can do to work with their local municipalities to show how critical EMS ambulance service is in the grand scheme of things. It's up right there with police and fire.
Correct. So thank you for bringing it up. I think education is great. I think local knowledge is perfect. Many times, the citizen doesn't really think about an ambulance in their community until they have to use it or call it for help. So I would encourage citizens and municipal leaders to look at their systems and say, is this effective? Is this efficient for us? You know, what can we do to help out some of the agencies, and not even just volunteer agencies, but even municipal agencies, to say, do we have enough resources? Are there enough units available to meet the needs of our communities? Many providers, again, work multiple jobs. Many citizens utilize EMS as their primary healthcare. They may not have the availability to go to their primary doctor, but when they have a medical problem or an issue, they call 911 and the ambulance comes. Citizens could help out in this case by, if they're going to call 911 for an emergency, is make sure you truly have an emergency. I know a lot of the physicians have telemedicine available, a lot of those resources out there. I would encourage, if it's available to you, to use that service before dialing 911. Assuming you're not really having chest pain, shortness of breath, unconscious, difficulty breathing sort of thing, then call 911. If not, you know, they can talk you through it. Some of our PSAPs, or public safety answering points, will ask specific questions to your illness to see how severe it is. And you may get either a delayed response, depending on how busy the agency is, or you may get an immediate response with the first response community getting involved in that.
Well, I know that one of the things that Governor Cuomo talks about, that, and certainly the county executive talks about it all the time, County Executive Latimer, and what we're doing here in Westchester, having to be the first place that had a containment area in the country, and now watching of how this has spread throughout the country. What things are we going to do differently as a government and as community members? And hopefully, Chief, one of the things that you're pointing out, and we'll let you wrap it up and tell us what you think, how we all can make sure to work together to learn from the experiences that we've had at this point in time, and remind everyone once again that if you do have any of those other symptoms that you just talked through, you know, shortness of breath, chest pains, etc., you still need to make sure to save those seconds by calling 911 and saving that life.
That is correct. And I think, you know, people may be afraid to go to the hospital, but if you're having a true medical emergency, again, be it a heart attack or a stroke or respiratory distress, minutes will make a difference. And that's where I think the community should look at those numbers and say, you know, day to day, you know, post pandemic, do we have the services we need? Do we really recognize our EMS resources as being critical and being a mandatory service in our communities? I think we really need to take a closer look at that. Okay. Just quickly on the training end, you mentioned we have a great training center, and we do. We do not provide basic EMT or paramedic training. There are a number of programs through hospitals and in our communities and community college that we have those, but we provide gap training. So for instance, if you needed training on pit testing for a N95 respirator, we would actually help your staff get trained. We actually have equipment we could loan out to you so you can fit test your members. You don't have to pay for that service. Additionally, so there's a lot of resources for the EMS agencies out there. I would encourage everybody to be safe. Maintain your distance from your coworkers if you're working out there or as a citizen. And again, my hat's off to the EMS providers who are on the front lines of this event and working very hard. So thank you.
Oh, all right, Chief, thank you so much. And we want to continue to thank on behalf of all the county residents, all those frontline workers that are dealing things. We talk about all the frontline workers, whether they happen to be retail store workers or people that are providing essential services like our fire, our police, our nurses, our medical professionals, our ambulance workers, the EMS folks, all those folks, everyone together, our nurses and all those things, that we're all out there doing this work. But again, for today's purposes, making sure that that person that's the one that's knocking on your door, that you called 911 for the ambulance service, that we're treating those folks with that same level of understanding and respect when we get through this particular pandemic and we go to the new normal. We got to make sure that we do a little bit better on making sure that we're doing those regional resources. And I'm looking forward to all of us working together through that as we get through the challenges as we go through this. So today's been another great opportunity to thank you, Chief Volk, and from the EMS and our Director of EMS Communication. Certainly for all the people of Westchester County that are paying attention and watching, we want to continue to get that feedback. Make sure, as Chief Volk said, that you talk with your local elected officials, your local officials working together and showing how important that ambulance service is, that it's a definite connection that we need to make sure that happens. So again, thank you so much for everyone participating today and listening, and keep up and stay safe. Make sure you're wearing your mask when you're outside in public and you're not able to social distance, and be safe, Westchester.